I think sometimes it's got to occur to those of you in the press that why does abortion always seem to inject itself into every issue? And I would suggest to you that there's an answer to that. And that is, there's one fundamental question that we as Americans have to answer. If we have the humanity that we say we do, we have to answer this question. Does abortion kill a little baby? If it does not, I promise you, I would encourage these and other people like me to walk over to the other buildings and forget about this issue entirely. But if abortion really does kill a little baby, then those of us in this sunlight of freedom today are also standing in the midst of the greatest human genocide in the history of humanity. It is that fundamentally simple, and that's why this issue keeps coming back again and again and again. And I just want to touch on one issue that a lot of people are a little afraid to touch on, but that's the whole eugenics, racist notions that are at the heart of a lot of abortion policies in this country. The reality is the abortion policy of this country came out of the days of slavery, when slaveholders were trying to get rid of the extra slaves, and the eugenics movement was born, and that morphed into Planned Parenthood. And today, 1 in 2 black children in America is killed by abortion on demand. And that is, if that statistic is right, it is a disgrace that beggars any ability of mine to express in front of you of all. But if we are truly committed to equal rights under the law in this country, then we better find out what happens when an abortion takes place, and we better find out what the racist policies are behind it. And with that, I guess I'll give someone else a chance. Thank you.
The president said abortion is a distraction in his effort to take over health care in the country. I would suggest to you, as mirrored by the leadership here from Congress, that protecting innocent human life and women from being exploited from organizations like Planned Parenthood is not a distraction. It's something we should all be focused on. This, in fact, as Congressman Smith pointed out, is a bailout. It's a bailout for Planned Parenthood. They've run into difficulty in their fundraising, and they're already getting a third of their $1 billion budget from the federal government, and that's not enough. And they want to increase it at the expense of taxpayers here in this country.
In the District of Columbia, 41% of the pregnancies in abortion, they're terminated. In this particular community, 75% of all the babies that are aborted are black babies. A few weeks ago, Senator Durbin, in questioning about this, talking to Senator Brownback, came to the conclusion that this was not important because the babies that died were black. That somehow it's okay that we're now going to ramp up this genocide by paying for it.
Now, what's become clear as we've been learning about the economics of this healthcare plan is that when the government is in charge of healthcare, it's driven by cost, not by quality of care. And the problem with that is it costs less to eliminate a patient than to treat a patient. And the first on the list to be eliminated will be the unborn. Well, if this health care bill is passed in its current form, these women will now face the added pressure of government bureaucrats who will say, hey, it costs the government less to pay for an abortion than to pay for your delivery costs. And women who have received a diagnosis that their unborn child faces a health care issue are going to find, they already face incredible pressure from the medical community that will only be increased under this health care plan. The first principle of healthcare is do no harm, and no healthcare reform is acceptable that mandates abortion or that leads to the eliminating of patients, the killing of patients who are elderly or disabled, simply because it'll cost the government too much.
It was judges, not